Horses have successfully been giving birth in the wild for thousands of years without man's assistance. A pregnant mare will choose a secluded spot away from the herd, lay down and deliver her foal in less than an hour. Because the horse's main defense from predators is flight, nature equipped the mare to be able to give birth quickly, and the foal the ability to be on its feet and ready to run shortly after parturition. For thousands of years, man has been selectively breeding horses, and even though over 95% of all equine births are routine and normal, man likes to take the role of midwife. In these days of modern horsekeeping, there are certain things that you can do to ensure a successful delivery. Video Velocity presents Foaling Fundamentals, a video handbook for healthy foaling. Breeding your mare is an investment of time and money. That is why it is important that your mare be checked regularly during her pregnancy by your veterinarian. He will help you plan a feeding schedule for her according to the type of hay available in your area and suggest the increases in protein that she will need during the foal's gestation period. At 9, 7, 5, and 3 months prior to her due date, she should receive inoculations of killed rhinopneumonitis vaccine. At 30 days before her due date, she should also receive her annual shot program. All through your mare's pregnancy, her worming schedule should be kept up to date. She should be wormed no less than 30 days before her due date. Your vet may also palpate your mare to check that the foal is alive and growing normally. 1 month before foaling, your mare's shoes should be pulled. When she's with her foal, there's always the chance that she could step on him, and a shod foot would cause greater injury. This is also the time to get your mare acquainted with the area in which she will foal if it is not to be her usual quarters. A clean, well-maintained pasture is the ideal delivery room. Because it has optimum ventilation and drainage, germs don't have a chance to grow. Few of us have access, though, to a pasture like this one that is kept free of weeds, fescue, and manure piles. Fescue has been known to cause abortion or other problems in pregnant mares. As you'll notice, this pasture is fenced with a tightly meshed wire that extends entirely down to the ground. Whether your mare is foaling in a pasture, paddock, or stall, one of the most important things you must do is ensure that either the fencing or walls are solid down to the ground. Many foals have been lost from inadvertently rolling out of their pasture or paddock. Both mare and foal panic and put themselves in the position for potential injury. This is not a suitable foaling stall. The gaps beneath the pipe-enclosed walls are potential traps for a foal's legs and feet, which could easily fit under the gaping space. The front of the stall is made of pipe panels that the foal could roll through, and when a mare's legs are extended when she's laying down, the pipe could also trap her. The mare should not share a pasture or paddock with any other horses either when she is foaling. Because horse breeding is such an expensive proposition these days, most horse owners choose to have their mare foal in a stall. It also makes the waiting game a little easier on the horse owner, but not much. This is an ideal foaling stall. It is 12 by 24 feet, though a 12 by 12 foot stall will do, but not any smaller. It is free from drafts, but right now the weather here is cold, so the mare owner has installed 2 infrared heat lamps to make the stall warmer when the mare delivers. They have been attached high, out of reach of any horse, and their cords safely secured on the outside of the stall and free from obstruction. The lamps are not left on continually. Because this is a professional training center, personnel are always around to monitor the lamps. Before the stall was bedded, it was stripped, the floor scraped down, and the urine spots limed. The walls were washed with disinfectant, and any feeders or obstructions that could potentially hurt the foal were removed. When foals are born, they have limited vision and bump into everything and try to nurse any object that comes within their reach. You can't be too careful. Thoroughness in cleaning the stall is a small bit of insurance that can go a long way, as newborn foals are easily susceptible to disease. A deep bed of wheat straw has been laid in the stall and banked up against the sides. If your mare is foaling in a paddock, you can make this nest in the middle of her enclosure after it has been cleaned. Shavings cannot be used as bedding for your foaling stall. When in labor, your mare will lose up to 6 gallons of fluid, which will cause shavings to stick to your newborn and transmit infection. Also, the shavings can get up his nose and impair breathing. Using straw will provide a more comfortable cushion and extra warmth for the newborn and mother. Keep your foaling stall as clean as possible. Daily grooming will help keep your mare in good spirits and afford you the opportunity to check on the changes in her body as the countdown to foaling approaches. Her udders should be kept clean, and as a good precaution, they should be manipulated to simulate the tugs of a nursing foal. This is especially important with maiden mares, as the nursing efforts of a newborn are often discomforting and could cause rejection. If you get the mare used to these sensations before foaling, she will not be surprised when the foal makes attempts to nurse. Gestation can range from 310 to 362 days, depending on the age, health, and genetic makeup of the mare, nutrition, climate, and even geography. An average gestation is 340 days. Keep accurate records of your mare's breeding dates. Premature and overdue delivery dates bring on their own set of serious problems. The foal lies on its back within the mare in a sac called the amnion, surrounded by amniotic fluid. The amnion is contained by the placenta, which has its own buffering fluids, which are the waters that initially break from the mare at the beginning of labor. The placenta is attached to the walls of the mare's uterus. The fetus is fed through the umbilical cord, through which he receives nourishment, oxygen, and eliminates waste. This cord passes through the amnion and is attached to the placenta. A couple of months before your foal is due is a good time to assemble your foaling kit. You will need your vet's phone number near the phone and a backup number in case he can't be reached. Some veterinarians would like to be notified of your mare's due date at least 1 month before delivery, and when you think your mare is within 24 hours of foaling. You'll also need a flashlight for checking your mare in the dark, a pad of paper and pen and watch for writing down the times of your mare's stages of labor in case she gets into trouble and for future reference. A foaling diary is included with this tape, as well as a list for compiling your foaling kit. You'll need sterile cotton for washing your mare's vulva and udder prior to birthing, and for applying betadine to the foal's navel, a bucket with a lid, and ivory liquid for washing the mare with a solution of ivory and warm water. Later, the placenta will be collected in the bucket with a lid for the vet to examine. The placenta may also be collected in a plastic garbage sack. And an athletic bandage. The mare's tail will be wrapped in the athletic bandage, which should be washed in between uses. Your kit should include several large terry towels. Make sure the towels have not been dried with Bounce or some other dryer additive. The towels should have no scent. After the newborn has been toweled off, it should smell like a horse, not fabric softener. Also betadine for treating the foal's navel, and disposable latex gloves. These can be obtained from your vet. They help keep the betadine application on the navel under control. You have a variety of options for treating the foal's navel with betadine. You can put the betadine in a lidded plastic container, and when you're ready to do the navel, remove the lid and apply the betadine with a piece of sterile cotton held in a hemostat. Or pour the betadine in a small spray bottle and spray it on the navel. Or completely fill a prescription bottle with the betadine and immerse the navel stump in the bottle. Most breeders routinely administer an enema to the foal after it has stood and nursed. This helps facilitate the passage of the foal's meconium, the waste it collected in the rectum while in utero. The Vaseline is for lubricating the tip of the enema applicator. Include a halter, chain lead shank, and twitch. In case your mare refuses to nurse her foal, you will need to shank and twitch her to allow the foal access to her udder. This is not a usual occurrence. Should the worst occur and your mare die, or the foal be rejected without having the benefit of nursing the first milk or colostrum, you'll need a goat nipple and soda bottle in order to feed the foal by hand. The nipple and bottle cost less than $1, and they're a safety measure that's worth having. When the foal has diarrhea during the mare's foal heat, you will need to clean the excrement from his hindquarters. The sponge will be used with the ivory liquid in warm water solution, and an application of Vaseline will keep the skin from chapping and prevent hair loss. The foal halter will help you control him. You may wish to order a mare foaling predictor kit at least 2 months before your mare is due. We'll tell you how this kit works and where to order it at the end of this tape. 1 month before delivery, your mare will still be quite active, even though she is now carrying approximately 150 additional pounds. At this time, the two most apparent changes that indicate impending parturition will start to develop. The first is that her hind end will soften, making her rump appear to sink away from her spine. The second change is that her mammary gland will enlarge, and she will begin to bag up. The size of her bag will change through the day, usually being larger in the morning. Remember, though, mares have been known to foal while exhibiting no pre-foaling symptoms at all. Your mare's daily ration should include a bran mash, since with all the space the foal is taking up inside her, she might be a little constipated. She will also require free access to good quality hay. To make a bran mash, take 3 pounds of bran, 1 ounce of salt, sliced carrots, and boiling water. Add as much boiling water as the bran will absorb without becoming runny. Stir with a spoon while adding the salt and carrots. Cover and steam until it is cooled enough to be eaten. Approximately 1 week before delivery, your mare's abdomen will become more pendulous, as the weight of the foal creates hollows in her flanks and her ribs may be more noticeable. The large milk veins on her abdomen might become more apparent, and her hind legs can retain water, or stock up, from the extra burden of the weight she is carrying. She should get some light exercise each day to help relieve this. Your mare will not be a very social creature. She will have trouble finding a comfortable standing position, and may actually rest her rear end against the wall of her stall in order to get some support. Her vulva will be enlarged 3 to 4 times its normal length, and her hind end will now be extremely jelly-like. Her bag will become quite large, and her nipples will be full and round. Usually 12 to 48 hours before birth, a wax-like substance will form on the end of her nipples. Not all mares wax up, though. Some mares wax, lose the wax, and wax up again. Milk may stream from her nipples. Watch for this. If she is losing colostrum, you may need to milk her and save the colostrum in your freezer for your foal's first milk. Your veterinarian should advise you in this situation. This mare's Kaslick's procedure is being removed by the veterinarian prior to foaling. Kaslick's procedure is the process of partially stitching together the vulva on mares with imperfect vulvular conformation, thereby prohibiting debris and bacteria from entering the vagina. Now, a foal alert device will be sutured to her. When her vulva spreads during delivery, a magnet is pulled from the device, setting off a remote alarm to alert the mare owner. More information about this device can be obtained from your veterinarian. As most mares foal in the evening, her tail should be wrapped and her vulva and bag washed with warm water, ivory liquid, and sterile cotton at that time. Separate the tail into 2 sections and braid them up the dock, crossing them around and over her tailbone. When you get about 6 inches from the ends of the 2 tail sections, tie them in a knot around her dock. Then wrap the athletic bandage around her tail. Start where the knot is in the hair and wrap up toward the croup. This mare's tail is very loose and can't clamp against her rump. This is another sign of approaching parturition. From the croup, wrap downwards and back up again, as shown here. During the day, take her tail down to give it a rest, and be sure to wash the elastic bandage. It's a good idea to wrap her tail so that it can't contaminate her vagina during delivery, and so that the hair doesn't absorb the urine, feces, and fluid that are expelled during delivery. When you come to the last 4 inches of bandage, twist it and coil it up like a snail, tucking the knot under a layer of bandage. To wash the mare, make a solution of warm water and ivory liquid in a clean bucket. Place large pieces of sterile cotton in the solution. Wash and rinse the mare's anus, vulva, hindquarters, and udder thoroughly. Approximately 24 hours before delivery, the foal has rotated into a diver's position, assuming a streamlined form that will facilitate his birth. His body is fully extended, with one foot leading the other, to reduce the bulk of his shoulders so that he can more easily pass through the birth canal. His front feet and nose are in position at the pelvic brim, which help dilate the cervix. His rump is tucked and rounded, so that he can better withstand the powerful contractions that will push him out. You can see these changes in your mare as the foal becomes tucked up inside. The deep indentation in her flanks will disappear. The typical delivery is rarely more than 1 hour. That is why it is useful to take note of the times of the different stages of labor, so that if something does go wrong, you'll have this information for your vet. Also, if you have a maiden mare, be sure that there are no unnecessary people in the area, and that the mare is in comfortable and familiar surroundings. Your mare will exhibit some or all of the following symptoms when labor is near. She will pace, snatch at her feed, get up and lay down, look painfully at her side as if she had colic, urinate and defecate frequently, lift her tail, paw the ground and snatch her feet up and down and kick at her abdomen, sigh and stretch, and sweat. Sometimes the signs of impending labor are similar to colic symptoms. However, a horse with colic does not eat and does not pass feces. If your mare is showing colic signs, trying to roll, and not passing manure, get her to her feet and call your vet. The pressure of the foal's feet pushing on the amniotic sac where it meets the cervix breaks the outer wall of the placenta, and the water is expelled. This fluid lubricates the birth canal. After the water breaks, the mare will take a breather. This will not last long, as her contractions will resume shortly. You'll now see the appearance of a pearly gray fluid-filled bubble. This is the amnion. If by chance the water doesn't break, and you see a reddish-brown basketball-sized shape appearing from her vulva instead of the amnion, you have a problem. The placenta has not broken. Call your vet. Then scrub your hands and break the placenta and allow the amnion to appear. This is a very rare occurrence. The mare is laying down flat on her side now, with her legs extended. Her weight actually contributes to the push of the contractions. Her contractions are usually 2 to 4 strong pushes, followed by short rest periods of 10 to 30 seconds. Visible progress should be seen with each contraction. Soon you should see the foal's first foreleg and then the other. His nose will follow. This arrangement helps prevent his elbows from getting hung up on the mare's pelvis. Be sure that these limbs are being delivered through the mare's vulva. There have been instances when a foal's hoof has been forced up through the roof of the vaginal canal into the rectum. If this is the case and the feet are appearing through the anus and not the vagina, get your mare up and walking and call your vet. As in over 95% of all births, this foal is being delivered normally, and the forelegs' hooves that you see are pointing down, indicating that a routine birth is taking place. Your key to red alert delivery presentations is the positioning of the foal's hooves, or the absence of their appearance. To be aware of what is normal, you must also be aware of what is abnormal. Major problems are rare. The key is to recognize when you have a real problem and then call for expert assistance. The following are malpresentations that a foal can assume during delivery. They all require the assistance of your vet to correct. One or both forelegs back, breech birth, abnormal breech, head turned back, twisted on back. These malpresentations and the normal delivery position are illustrated on the back of the foaling kit list and foaling diary sheet that is included with this tape. At any time during labor, your mare may get up and lay down to reposition herself. Don't be alarmed if she gets up and walks around with the foal partially delivered. If she is laid down too close to the walls of the stall and there's a chance of her crushing the foal, you can make her get up and lay down in a more suitable spot. Just be sure that with each contraction, you see visible progress. Once the forelegs, head, and shoulders have appeared, you may enter the stall and quietly clear the amnion from his head and shoulders. Remember that your hands should be clean. Using your fresh towel, clear his mouth and nasal passages and give him a good rub, but be careful not to disturb the umbilical cord. Right now he is receiving his last pint of oxygenated blood through the cord, and you don't want it to break prematurely. Make sure that your foal is breathing. If he is not, vigorously rub his body with your towel, and again make sure that his mouth, throat, and nasal passages are not obstructed. If that doesn't work, elevate his chest and let his head relax in a downward position while continuing to rub. As a last resort, administer artificial respiration by aligning his head and neck in a straight line. Cover his mouth and one nostril with your hand, and with your other hand, support his head while exhaling into the uncovered nostril. Your respiration should not be too forceful, and the breath should come in approximate 2-second intervals. If everything looks normal, leave the stall. Your mare may rest again at this point to recover for the last push that delivers the hips. The hind legs usually slide out on their own. The time frame in which you have seen this delivery is real, and most births happen in this short a time period. If the process seems delayed in your mare's labor, call your vet. The mare now will usually be slightly disoriented and may not at first be too interested in her foal. This is a very important time for mother and newborn. The mare will nicker to the foal, sniffing and licking it. Do not disturb this process. After the mare and foal have had some time to bond, you may peel the amnion from his back and hindquarters and dry him off some more. If you plan on imprint training your foal, begin the procedures after the mare and foal have bonded, but before the foal rises to its feet. We'll show you an overview of imprint training later in this tape. The foal will become more active, and through its motions the umbilical cord will break on its own. This is the point at which many mare owners first see their new foal. Mares are very secretive about parturition and can foal in a matter of minutes. Most likely your mare will do fine on her own, and your first duty will be to betadine the foal's navel. Thoroughly saturate the navel with the betadine. Try not to let any drip down his sheath if you have a colt. Dose the cord again 2 hours later during your foal's first day, and make sure that no urine is dripping through his or her navel stump. If this situation has occurred, your vet can remedy the problem, but let him know right away, as the wet navel is an easy source of infection. When your mare stands after delivery, the amnion will be hanging from her vagina. You need to tie it in a knot to keep her from stepping on it and pulling it out. You may need to retie the knot further up as the amnion works itself out. If the afterbirth were pulled from the mare, serious damage could be done to her reproductive organs. The afterbirth should be expelled within 2 hours of the birth of the foal. After the final contractions deliver the membrane, you should remove it from the stall and keep it in a lidded pail or plastic sack. Your vet will examine the afterbirth to ensure that it is complete and that no part is still inside your mare where it could cause an infection. Now when she gets up, your mare should have her vulva and bag washed with warm water. Your foal should stand and nurse within an hour. Don't attempt to help him unless an hour has passed and he hasn't made a good effort to get to his feet. This guy was trying to get to his feet and nurse almost immediately. It will take him a while to find the nipple and nurse, but all this struggling is making him stronger and getting his circulation going. He may even shiver while getting his engines initially fired up. If your mare won't allow the baby to nurse, you will have to restrain her. It is vitally important that your foal gets his first meal of colostrum within the first 2 hours of his life. The colostrum contains vital antibodies that defend the foal against disease. Its high fat content gives the foal energy and strength, and is also a laxative that protects the foal from constipation. To restrain the mare so the foal can nurse, halter her with a chain lead shank and position her with her rear end in a corner. Lift the front leg that is nearest you, and usually she will acquiesce and allow the foal to nurse. If she still doesn't cooperate, twitch her as well. Remember, though, to use the least amount of restraint necessary. While nursing, the foal's mother may lick under his tail to stimulate a bowel movement. Most breeders, though, routinely administer an enema. The passage of the foal's first stool, or meconium, is very important. This is the substance that collected in the foal while he was in utero. Warm a baby enema in a pan of hot water until the enema fluid is tepid. Lubricate the tip with a bit of Vaseline. With help from another person to restrain the foal, insert the tip gently and slowly expel the fluid. This is usually all it takes. You can tell that all the meconium is gone when the foal's stools turn to a soft mustard-colored material. Your mare will be hungry and thirsty now. Give her a bran mash and check to make sure that her water is not too cold. Tepid water will suit her best at this point. Now you would think you could get back to a schedule like normal people, but your foal watch is not over. It is very important during baby's first 24 hours to make sure that he does the following with great regularity. He nurses, is physically active, defecates and urinates, and naps. In the absence of any of these, call your vet. Imprint training is most effectively done right after the foal is born and before it has gotten to its feet. If you don't have the opportunity to imprint your foal soon after birth, it's still worthwhile to do the procedures with a foal that is even several hours old. Foals are fully developed and ready to stand and run less than an hour after being born. This is a critical learning period of which you can take advantage by doing some simple training that will last your foal a lifetime. Here is Dr. Robert M. Miller, a noted authority on equine behavior and expert in equine imprinting, starting the training with an Arabian filly. He begins by toweling her off thoroughly, and then desensitizing her head, paying careful attention to her ears, poll, face, lips, and gums. Her head is gently bent back in the same position as it was when she was in the womb, a non-flight position. He continues to desensitize her entire body, working her legs, feet, saddle area, girth, chest, croup, and tail, being careful not to desensitize her flank, as that's a part of her body that should be left sensitive, so that she responds to the leg when ridden as an adult. Whether rubbing the filly, tapping her feet, or flexing and extending her legs, he does the procedures dozens of times to ensure that the filly is completely desensitized. Then, so that she will not be afraid of these objects in the future, Dr. Miller rubs a newspaper and plastic bag all over her. Next, a pair of electric clippers are run over her body, taking care not to actually clip the filly, but to desensitize her to their sound. Then she's sprayed with warm water from a bottle and dried off with the help of a hairdryer. Each of these procedures are done on both sides of the foal. Dr. Miller finishes by gently palpating the filly's rectum with a lubricated, gloved finger and administering an enema. Imprinting of equine foals is rapidly gaining favor with horsemen all over the world. A comprehensive 2-hour imprinting videotape with Dr. Robert M. Miller has been produced, entitled Early Learning. Besides imprint training, it also shows you how to halter break your foal. Teach it to tie and load in a horse trailer. Retailing for $39.95, you can order it directly from Video Velocity at 800-284-3362. This segment has shown you just a small portion of the imprinting techniques, but by using them, the result will be a foal that is trusting, responsive, and unafraid. You're actually increasing the value of your foal with this small investment of time. By now your vet's office may be open, and it's time to schedule your mare and foal for their postnatal exam. Your vet will examine the color of the mare's mucous membranes, check that her vagina is not bleeding or vulva torn, and ensure that her milk production is adequate. He will examine the foal for congenital problems, check his palate, legs, and eyes, and make sure he's passed the meconium. Usually, he'll give the foal a tetanus shot and IgG test that measures the immunoglobulins in the foal's blood to ensure the adequate passage of antibodies from the mare's colostrum. He'll spread out the afterbirth to ensure that all the parts are there and none retained inside the mare. Not present in this afterbirth was the usual small, brown, sponge-like detached object called the hippomanes. Its function is still disputed in veterinary medicine. Mother and baby can be turned out into their own paddock in 24 hours if the weather is good. The paddock should be safety-proof, just as your stall was. During your foal's first week, he won't gain much weight or height, as most of his energy is devoted to getting his body acclimated to its new environment. He may actually nibble on his mother's manure, and this increases the number of beneficial microorganisms within his intestines. This is one good reason why your mare's regular worming program is so important. In 2 to 3 weeks, they can be turned out with other horses. When turning out the mare and foal, lead the mare several feet from the foal and release her, while someone else holds onto the foal and then lets him go shortly after. This will prevent the mare from accidentally injuring the foal should she kick up in her exuberance to be free. Approximately 11 days to 2 weeks after delivery, your mare will experience her full heat. It is believed that the hormone change in the mare affects her milk and is the cause of the usual foal diarrhea at this time. Your foal will need to have his rump cleaned with warm water, soap, and a sponge. At this time in his life, your foal may also develop a fondness for chewing on his mother's tail. You can discourage this by applying some of the ivory liquid to the mare's tail. Its taste will soon discourage the foal from chewing. An application of Vaseline or mineral oil will prevent chafing. This diarrhea should go away within a couple of days. If it does not, and your foal appears to be lethargic or dehydrated, call your vet, as serious dehydration can develop from prolonged diarrhea. If you breed your mare, the foal should be kept a good distance from the stallion while being held completely under control. The mare should be able to see the foal at all times, otherwise she may panic. At 2 to 3 weeks, your foal's navel will have dried up and fallen off. He should be wormed at 6 weeks and receive his first full slate of inoculations at 2 months and boosted 30 days later. Your foal will start eating solid foods on his own at 1 month. You may set him up with a feeder like this so that he has food of his own, or using a round rail, diagonally fence off a corner of your paddock and create a creep feeder. A creep feeder will serve 2 purposes. Besides giving the foal a source of nourishment without competition from his dam, it will also take him away from her for periods of time each day. Weaning is a particularly stressful time for young horses. A Texas A&M study recently found that horses who were weaned gradually suffered less stress. At 4 to 6 months, your foal may be placed in a paddock with a fellow weanling, next door to their mothers. Even though separate, they can still see and touch each other through the fence, but be sure he can't reach through and nurse. Gradually, the mares will lose interest in the foals and can be separated completely, resulting in a problem-free weaning. Your farrier can contribute to the health and straightness of your foal's legs at this early age. Get your foal used to having its feet handled. This filly isn't too happy about her predicament. but with her owner holding her against the fence so that she can't wriggle away, the farrier gets the job done. A foal's hooves can develop points that prevent him from breaking over correctly at the walk and trot. These need to be rasped off. Also, depending on the ground where you live, he may not be wearing down his hooves fast enough and growing too much toe or heel. Developing good manners for the farrier can begin at any age. Breeding a mare and raising a foal can be a very rewarding experience. As mentioned at the beginning of this tape, 95% of all equine births are normal and routine. With the information given you in this production, you should be able to care for your mare and foal with confidence. A foaling kit inventory, foaling diary sheet with diagrams of foal presentations on the back is included with this tape. For additional copies, send a self-addressed stamped envelope and 25 cents each copy to Video Velocity, Box K, Virginia City, Nevada, 89440. To provide further assistance with foaling, you may wish to use a Mare Foaling Predictor Kit. This kit will help you to narrow your foal watch from 1 to 2 weeks down to 2 or 3 days. It works using water hardness test strips, distilled water, test tubes, syringe, and a comparison chart. First, the mare is milked into a collection cup. Then, a test tube is filled with a certain amount of distilled water. 6 milliliters of the mare's milk is drawn up in a syringe and deposited in the tube with the distilled water. The tube is capped and the contents gently mixed. Now the tube is uncapped and a test strip is inserted in the tube, wetting all 5 squares of the test strip thoroughly. The strip is removed and the excess liquid shaken off. After 60 seconds, the strip is compared to the chart. If the 5 squares on the strip remain green, chances aren't likely your mare will foal in the next 12 hours. If 3 squares turn from green to purple, you have a 40% chance of your mare's foaling in 12 hours. If all 5 squares change to purple, get ready. It's likely your mare will foal today. The change in calcium ion concentration in your mare's milk is what causes the squares to change color, and also is a sign of imminent birth. You can order a Mare Foaling Predictor Kit from Video Velocity at 1-800-284-3362. The kit is $29.95 plus $4 shipping. It includes 15 test strips plus all the equipment you've seen for prediction and a book of complete and easy-to-follow instructions.